begin now with the final plenary. I'm going to introduce the plenary properly in a minute, but before that, the plan was that we would ask James, as the leader of the EUBorderscapes project, to do a sort of finale for the end of the conference, but he has to get a plane. So we're just going to invite James Scott up now to do the finale, and then we're going to come back and I'm going to introduce the plenary.
Well, thank you, Georgie. Finale, I'm not exactly sure if that's what this will be. Basically, I would just like to, before anything else, express my gratitude to UEL team for putting this together, to all the participants for coming and engaging in very interesting discussion, and to activists, people who are concerned about community issues, migration issues, because they all very much affect our understanding of borders, and borders affect understandings of community and migration. It's kind of a mutual relationship. And I think that this, of course, if we would have had 500 people, we would be absolutely overjoyed. I think we had very good participation. And I think that the conference achieved what it set out to do, namely profile itself as a policy and impact conference. I think it did just that. We're very grateful for this within the EUBorderscapes consortium, because as I mentioned at the very beginning, one of the challenges that we have is getting out of our everyday working routines and then thinking through what we're doing, and then trying to ask ourselves and answer the question, how can we make this information more accessible? How can we make it more understandable in terms of everyday bordering problems, issues that are really close to policy? That's not always self-evident that can be done. You have to really think it through and then see what kind of messages emerge out of your research. And these kinds of events force you to do that. And I think that's very important, because there's a lot going on within our project, but other let's say, projects related to borders, where there is a message, important message of wider societal dimensions that has to come out. And I don't want to elaborate the point too much or pontificate too much. I just would like to say that this has been a very interesting experience, not only because of my first time in the Docklands and seeing this part of London I've never seen. It's become visible for me. And the other thing that I was really astounded about is the borders everywhere you walk here. I mean, it's not just the DLR and scanning in and scanning out with your Oyster card. Don't forget doing that, because you'll have to pay a fine if you don't. But all the tripwires at the campus here, the security cards that you have to flash in order to open the fire doors, the access, how incredibly restricted it is, going to the pub, asking, are you a student or staff? No. Do you have identification? So pass out, my passport. Okay, you can go in and have a. So that in itself was very interesting, is how everyday life is being securitized. Not just here, of course. In some places, it's perhaps even more extreme. That is maybe just a side point, but I think it's also germane to our overall discussion that, are we over-securitizing our lives to the extent that real conviviality, real community is no longer possible on a communicative basis. On that note, again, thanks to everybody for coming to engage in this discussion. Very rich theoretically, but also in terms of policy and the societal message that borders are everywhere and that we have to be cognizant of them and what they do to people, what they do to groups. They're not something that are self-evident. Thanks for getting that message out. And without further ado, I will let this panel proceed, this final panel of the conference. Okay, thanks. Here, Joe.
Thank you, James. Thank you very much, James. Okay, so this final plenary was set up knowing that over the last couple of days we've had an awful lot of discussion around theoretical issues relating to borders, bordering, borderscapes. And the aim of today has been to have a look at the impact of these bordering regimes and these bordering technologies on the ground, both in the UK and in Europe. As illustrated by what James was just saying about the kinds of borders that he's been encountering as a visitor from eastern Finland. So our original plan, as everybody knows, was at the beginning of the conference was to invite the chair of the Parliamentary Home Affairs Committee to come and listen to us and to some of our partners working in the voluntary sector in Europe and in mainland Europe and in the UK, in order to really look at the impact of some of the policies that we've been discussing and the complexities of this multi-scalar, multi-localed border. So he wasn't able to come because of some diary clash on Tuesday, so we wrote to everybody and said he's going to come today. Well, I was just about to jump on the tube this morning and the phone rang and it was Keith Vaz. And he said to me, I'm terribly sorry, I have to apologise, I've got an urgent meeting, the Prime Minister of India is coming. So I said, yes, you know, it's been in the news for the last month. He said, yeah, some urgent things have cropped up. I've got to meet with the Muslim Council of Britain. Those of you who know about what's happening in India and the politics of religion will maybe understand why that's the case. So anyway, I said, well, I guess the Prime Minister of a country of 1 billion people trumps a small European conference in the East End of London. And he apologised and said, well, I would like to invite you and some other people, I would like to do something about this and invite you to Parliament to give evidence in a select committee. So what I really hope is that though Keith Vaz MP is not here this morning, that we can somehow, with our partners, use this strategically in order to present some of the things that we've been talking about to the select committee. And I know, having just talked to some of our partners here, that will be something that's quite welcome. So we don't want to waste this opportunity. So anyway, Neera just wanted to say something about the current Indian Prime Minister and her own experiences in Gujarat in 2002.
Thank you very much. I think that one of the messages, as James said, and we talked before, is and the main finding in terms of the UK is that the cumulative introduction of everyday bordering in Britain, and I think Britain is just the pioneer here for the whole of Europe, is undermining convivial, multiculturalist, pluralist Britain. But I think what is happening with Modi here, and also the meeting with the Muslim Council of Britain, is a very good example not of the transformation in Britain from multiculturalism, which was mostly affected by the post-colonial heritage of Britain, to what some of us have been calling multi-faithism, in which the identity politics of minorities in Britain has been transformed to be constructed according to religious terms. Modi is not just the Prime Minister of India. He is the leader of Hindu fundamentalism and Hindu fundamentalist party in Britain. And as Georgie said, I was part of an international women's delegation that was sent to the Gujarat in India to investigate the gendered impact of the pogroms and the slaughtering of Muslims in the Gujarat during 2002. And we were absolutely appalled to hear that Keith Vaz, the head of the select committee in Britain, was not only supports Modi, and apparently he wrote in the newspapers today, but also the whole kind of Olympic-style rigmarole that is organized today in Wembley in his honor has been, I mean, it's a combination of fundamentalism and neoliberalism. The funds has been raised by a billionaire Indian who is a supporter of Modi. And apparently, I don't know, I don't want to libel him unjustly, but I was told that he also donated some money for this welcoming. So obviously, the need to negotiate between the Hindu fundamentalist or just Hindu identity community and the Muslim one has become a very major kind of other building blocks of the context of this everyday bordering which is taking place. So sorry for this deviation, but I thought that it is too good opportunity not to kind of highlight some of the context in which we are operating.
So this plenary is looking at the impact of current bordering issues and regimes on the ground. We've ordered it so that we're going to start off in a European context, but one which many people are not so familiar with, which is the impact of European bordering policies on Roma, Sinti populations across Europe. So our first speaker is going to be Miriam Karoli, who's going to be talking about that issue. She's then going to be followed by Rita Chadha, who's going to be talking about the impact in East London and Essex and across Britain more generally. And then we're going to move on to Lee Danes from Doctors of the World, who's then going to expand through talking about some of the impacts that they're seeing from a health perspective within London, Calais, and also across the rest of Europe. So just to introduce Miriam. Miriam is chief of the contact point for Roma and Sinti issues and senior advisor on Roma and Sinti issues at the OSCE Office for Democratic Institutions and Human Rights. She's a political scientist by education, and in her professional career she's focused in particular on human and minority rights. She served as Senior Communities Advisor at the Organization for Security and Cooperation in the field mission in Kosovo with a focus on communities and the situation of Roma, Ashkali and Egyptians, and the return and reintegration of refugees and displaced persons. She's been an active member of the Austrian Roma Civil Society with work experience in civil society section and the Austrian Ministry of Foreign Affairs. She's also a member of the Austrian Ethnic Council for Roma and Sinti at the Federal Chancellery of Austria and a board member of the non-governmental organization Romano Centro in Vienna. So thank you very much, Miriam.
Thank you very much for the introduction. So thank you very much for the introduction, and thank you also for inviting me here and to join this, I think, very topical and very interesting and important conference. And I had the chance yesterday to listen to some of the presentation which also relate very much to our work. And so I would like to thank with that. I will set up my presentation, and I will not speak too much actually about the work we are doing because it would take so long, but I brought a fact sheet and I would like to hand it out so you understand a bit also like where we come from and actually what this, as Georgie said, very long name, OSCE, Office for Democratic Institutions and for Human Rights and Democratization is doing, especially with regard to Roma and Sinti. So can I just give this around? It's a short fact sheet. And then I will open the presentation. And I'm of course happy to answer everything also relating to very practical work then, what the OSCE is doing on that. Sorry. I just want to make full screen. F5, thank you. Great. So I was asked to speak about social and political impacts of contemporary European bordering, the case of Roma and Sinti in the wider Europe. And Georgie introduced me like what impact does have European borders, but I will go a bit beyond it because when it comes to Roma and Sinti, actually a huge part of the population is today within the European Union. And so it's not only a question of bordering them within national states, since of course as European Union citizens they should have the right to freely move, but also a bit to discuss actually to what extent they are bordered in within their societies. As I said, I will not go in detail actually what the Organization for Security and Cooperation is doing on Roma and Sinti. However, I want just to put a bit in the context because I think it's quite interesting for the topic of your conference that the Roma and Sinti was actually, put on the OSCE agenda and the International Human Rights Agenda within the OSCE in 1990. And this was done with a Copenhagen meeting where the participating states, and today we have 57 OSCE participating states, said that we condemn totalitarianism, racial and ethnic hatred, anti-Semitism, xenophobia and discrimination against anyone, as well as persecution on religious and ideological grounds. In this context, they also recognize the particular problems of Roma and Gypsies. And I put it here because the interesting point was then, this happened in 1990s, actually after the so-called fall of the Iron Curtain, and was triggered exactly because of migration trends from Roma from the eastern part of Europe to Western Europe. So the main actually intro into this topic was not a pure human rights agenda, but actually seen that Roma migrants have arrived to Western Europe and that they felt could be a threat. However, I have to underline that it was especially at that time also the High Commissioner for National Minorities of the OSCE who underlined that Roma and Sinti across Europe and the wider Europe actually face particular problems when it comes to migration, but also when it comes to racism and discrimination in their countries, which actually triggered their migration. So over the years, the OSCE has developed certain policy, recommendations to address the situation of Roma and Sinti. And when we look in the last 2 decades, it was interesting that often it was actually relating to migration, though the instruments would not necessarily reflect particular on migration, but on the root causes. So what I said before, when it comes to bordering Roma, it's interesting how they are framed throughout the centuries actually as the other within a society, and I think has a huge impact actually on their situation nowadays. So what is the stereotypical perception of Roma and Sinti? As I said, they're historically ingrained stereotyped as itinerant, vagabonds, nomads, thieves. They steal, exploit children. They're inherently criminal and nomads, asocial, free and wild people, or beggars. And I wanted to underline this because it's something which, persisted throughout centuries. But even if you look today at media or the public discourse, you see very often this kind of connotations used by the media or by politicians. So in many countries, and this of course applies particularly when you have Roma migrants appearing in a country, but not only, you also have it actually in the countries of origin. The political discourse often portrays Roma as being asocial, a burden to the taxpayers, abusing social benefits, and in this context, particular Roma migrants are portrayed as security threat, as forced asylum seekers or mobile bandits. And I underlined these mobile bandits because yesterday there was a presentation done on policing in Roma, and for example in the Netherlands there was a commissioned publication just produced 2 years ago, which actually was called Mobile Bandits, but uses pictures of Roma in a village, So it's quite interesting how this connotation is used, and this actually is for a training of police officers. And I wanted to underline that because it has a huge impact also on what we see is this, especially since 2008, the increased secularization of the public discourse, both when it comes to the discourse of Roma migrants, like the security threat from outside, or a security threat from inside because they're a burden to society. I will not go into that, but I just put here some examples actually how politicians refer to Roma and Sinti, and especially I put here 2 examples where they refer to Roma migrants. There are much more, and I put here the link, you can look it up, but I think they just reflect what is usually something we see. What is interesting to look is a bit maybe what triggers Roma and Sinti migration, but it's also important to understand that when you look globally and you would actually look at the real data, Roma migration is not something which really counts in numbers. And it's very interesting because there's little evidence knowledge about the numbers and migration trends. On the other hand, it's very publicly and exploited by the media discourse, and it seems to be very visible. Sorry. This year, Niels Muchniak, the Council of Europe Human Rights Commissioner, said we have to debunk the myth of Roma invasion. And he said this after having done certain country visits to countries where you had reportedly Roma migrants. And he underlined that the numbers are not growing, and there's also no evidence that shows that Roma are more motivated to migrate than other parts of the population. And this, I think, is also throughout, the last 20 years. It's not something that you can say in the 1990s there was a huge Roma migration. It was also within the global perspective a rather small numbers. But if we look at what are push factors for migration, as I mentioned before, it was in the 1990s, the political and economic transition of Eastern Europe. There were a number of reported hate crimes, ethnic conflict, widespread racism and discrimination, high unemployment rate, and no means for economic survival. This was also the time when actually the international community, and especially the human rights agenda, took more attention of that, having the reports of hate crimes against Roma and thinking how can we respond to that. And as I mentioned earlier, this was actually related to migration trends that you had suddenly, especially Romanian Roma, for example, in Germany. Then we had another incident, which was the conflict in the Western Balkans in the 1990s and the Kosovo conflict in 1999, which triggered also Roma migration. And there again, it was mostly because Roma were coming in between the conflicting partners, and they tried simply to leave and find a safe country. It's also interesting because when we talk today about the recent migration and refugee crisis, as it's called or labeled in Europe, that there is a discourse, especially in Germany now, going on saying that people who came from the Western Balkans have to return because there are other people who are more in need. And in many, especially in Germany, we all know that these are Roma because they had this temporary residence or as permission and are now being deported back. Then it's interesting, and I would say this was really not, this is almost minimal in numbers, but definitely there was again a discourse in 2004 and 2007, and when several countries joined the European Union, especially in 2004, the Czech Republic, Slovakia and Hungary, and then in 2007, Romania and Bulgaria, because all of these countries do have a considerable Roma population, and they, of course, also, like any other, made use of the possibilities to migrate. Similarly, also in the visa liberalization process with regard to the Western Balkan countries, especially Serbia and the former Republic of Macedonia, there are also, okay, I have 5 more minutes, sorry. We saw another people arriving from these countries who used the opportunity to move freely. And they are actually now often halted at the borders. So I will go over this. sorry, but I just maybe to say something about the photo, because I mentioned bordering. This is a photo from a Slovak village where Roma are segregated. You have around 500,000 Roma living in Slovakia, and 1/3 of them living in segregated neighborhoods, which also means, of course, segregated education and so forth. So they are kind of within the society excluded. Maybe let me just underline, so what is the response or the impact actually of the people's life? So what we see is restrictive policies, ethnic profiling, eviction and rapid mass collective expulsion, for example in France or in Italy. Eviction of people without any safeguards or providing adequate housing condition, and restriction of freedom of movement by profiling, people who are not allowed to leave a country or who get a stamp in their passport. These are just examples, I will go over it. But so because I yesterday listening to the discourse, it was also actually what could be a simple policy approach. And I think one of the most important things is like to recognize the issue and address the root causes. This has been done many, many years ago. The OSCE has developed a very specific action plan on improving the situation of Roma and Sinti in 2003. We have also done monitoring reports, and the underlying factor is that states are not committed with a genuine political will to really address the situation of Roma and Sinti. So if you think about migration, you have to recognize the issue and address the root causes for it, meaning sustainable integration into their societies. And here it's also interesting because in many countries, Roma are labeled as a European problem, meaning, you know, they are not recognized fully as citizens of the country, but actually Europe should deal with it, which I think is also interesting in the context of bordering. I just put here also 2 other important initiatives, the regional initiative Decade for Roma Inclusion, which just ended, and also at the European level in 2011, the European Union adopted a framework for national Roma integration strategies. I mentioned, and with this I would like actually to come to an end, that we have done twice actually a status report on the implementation of what have states done to address the situation of Roma and Sinti in their countries. And there's a visible progress in the development of national strategies, policy documents, action plans. There's also more funding made available targeting Roma inclusion, especially by the European Commission. There are normative changes. The anti-discrimination legislation has improved in a number of countries. But there's a lack of genuine political will and lack of implementation at the local level. And the local level, I think, is really here what counts. Also, especially between 2008 to 2013, the gap between Roma and the mainstream has been widening, which is quite interesting. And of course, we can also discuss a huge impact on that was the financial and economic crisis, also in the rise of anti-Roma sentiment. Here you see it's maybe unfortunately not very good here, but you can look it up on our webpage. It's actually a work we did very recently with Roma youth, and where we looked at statistical data actually which shows the discrepancy between Roma youth and mainstream youth in the area of education, employment, access to social services and health. And it's very telling because if you think that for 20 years policies, you know, are being adopted and implemented, actually we see at the ground that it does not have a real impact. I also just showed a publication where you can find it. All is free available on our webpage. And I want also to underline maybe to a bit more positive outlook at the very end. What is important, I think, to recognize that discrimination, like systemic discrimination and racism against Roma and Sinti exist. No policy will work if you overlook that. And also to recognize the potential of Roma and Sinti, including their women and youth. And especially because we had yesterday a discussion about, you know, when we talk about Roma migration, what is the picture you have in mind? I wanted actually to show this picture. It's one of our activities. We try to actually promote active engagement of Roma and Sinti youth, and there's a great potential out there who should participate in any policies being implemented or addressing the situation of their community. So I will stop here, and I hope I inspired for a lot of questions. Thank you for your attention.
Yeah, we're going to save up all the questions until the end. Rita, do you want to come up and put your get your presentation ready just while I introduce you? So Rita Chadha is Chief Executive Officer of the Refugee and Migrant Forum of Essex and London, known as RAMFEL. She joined in 2006 and has spent the last 10 years actively campaigning on a variety of equality issues. In 2013, she led the national campaign against the Operation Vulcan and Go Home vans. These were vans that went around London telling assumed illegal migrants that they could phone a number and be sent back home. She's a regular commentator on migrant issues, she is involved in lots of other panels and yeah, she's around. So thank you very much, Rita.
Thank you, George. Okay, I'm going to gallop through this because I've just realised I've probably got too many slides for 15 minutes, but these will be available through the organisers afterwards. My presentation today is about policing and immigration, and territorial policing in particular. So I'm going to start with a brief history of contemporary immigration enforcement. I'm going to touch again on Operation Vulcan, because Operation Vulcan actually marks a turning point in how the UK government has sought to conceptualise immigration enforcement. HOE, which is the Home Office Immigration Enforcement Team, and their targeted operations, something that is called Operation Nexus, which is a very, very strange policing operation, but also shows you the challenges that agencies have around immigration enforcement. We'll then talk about territorial policing and ask some hypothetical questions about what is going to happen next. And also, I'm very keen these days to actually be preventing some solutions. Now, I could say, well, do away completely with immigration enforcement, and that would make the whole thing a lot easier. But actually, let's get real, it's not really going to happen. So I'm attempting to offer some other alternatives. What's going round is a flyer which tells you the work of RAMFEL does. RAMFEL is based in East London. Just down the road, we cover this borough, Newham, here as well. And we cover the whole of London and Essex. And the reason why we cover such a large patch is we're one of only, well, I think we're the only organisation left now in London that provides free immigration advice. And that's not legal aid funded, it's totally free of charge, and it works with the most destitute of individuals, not just asylum seekers, but people who've had immigration status problems in other ways as well. So, starting right at the beginning, a brief history of contemporary immigration enforcement. The big change that happened in the UK was actually with the Go Home vans. The Go Home vans marked a new way of the government thinking about how it dealt with immigration enforcement. And to our mind, it actually signalled a high visibility presence of immigration enforcement techniques. And this was most notable in the Go Home vans itself, which, for those of you who don't know, was a van, literally, which had the words "Go Home" on it, written in English, that was encouraging anybody without status to go home. Now, there's a government evaluation report which says that 11 people went home as a result of it, but didn't really work. It was on the streets for about 2 weeks before we got it stopped. But there's another official report which also says only one person went back at the end of it, the 2 weeks as well. So there's an issue there. It's important to remember, we often in immigration talk about UK Border Agency, UK border control. It's important to remember actually that there's been an internal separation. The Home Office have been very clear that it's now UKVI who deal with applications for settlement, and HOE, which is about Home Office Immigration Enforcement. And if I've got one beef, it's that we as activists, and I class myself in that category, get the phrases blurred, and we don't inform the communities we're working with accurate terminology. It's vital that we remember HOE is an immigration enforcement department. Their sole role is to actually get people off the streets. There's and return them to their country of origin. There is a focus in the current immigration bill that a lot of you will be aware of. There's an immigration bill 2015 going through at the moment, and in 2014 we saw the start of some really immigration enforcement being taken out into the UK communities. So you have private landlords required to check immigration status. You have doctors and medical clinicians, practitioners being asked to inform on people's immigration status. And you have a terrible problem with children's social services, where actually social workers and Home Office officers are actually working together in social services departments. We've also got the co-option of faith groups and civil society organisations. There is an organisation called the Sikh Council of Great Britain that was given £60,000 by Theresa May 2 years ago to actually help Punjabi nationals go back home. Now, we've asked several times for reports on what that organisation has done with the £60,000, and amazingly, nothing. We've got no reports back. Nobody seems to be accountable for public funding of £60,000. You also have organisations, national renowned charities that actually many people have held dear, like Victim Support, like Crime Stoppers, and actually some of the larger national homeless organisations across the country, who are now also told to inform on people who haven't got status. Now that's hugely worrying, because often these organisations are a lifeline for actually helping people without status as well. And there's always an inference and a link to criminalisation, which I know other speakers over the last 2 days have touched upon. There's also an issue of victim blaming. If you haven't got status now, it must be your fault. Can't be the fault of the system for not making a decision and keeping you in limbo for 8-9 years. It's your fault because you haven't got it sorted. And that's a significant change in thinking as well. Operation Vulcan, so as I said, this is the van itself. Are you in the UK illegally? Note it's only written in English. This is taken very near to where our offices are. And it went round 5 London boroughs. Now, nobody that I know in any of those boroughs actually went back. And actually, we don't advertise. Our job is to help people stay in the UK. But occasionally, we do get people who say, I've had enough, I can't make it here, I want to go back. And actually getting somebody out of the UK is actually more difficult than helping them to stay here. And there's a documentary that we were featured in which shows you that it took us 2 years to get one person out of the UK because the Home Office just kept losing his paperwork and he couldn't get the right documentation. The problem with the Go Home vans was that it wasn't done properly in many ways, but the key thing was they hadn't done what was known as an equality impact assessment, or shown how they would assess for the adverse impact that this could have had on different communities. So we took a legal challenge with solicitors from Dayton Pierce Glynn, and we were successful in getting the van stopped within 2 weeks. During that time, there was no public political leader who was prepared to come out against the vans. They came out once we won the legal challenge, but nobody said anything when we were desperate to get the vans out. It's an untested methodology. If you ask the Home Office, and the Home Office are very good at this, and the researchers in the room may be particularly interested in this, they'll say they've got their own evaluation department. They've done this around the private rented scheme at the moment. And they'll say they'll do their own internal evaluation. Now, I'm not a social scientist, but even I can tell from basic methodology that actually some of their systems are quite skewed. And it's worth looking in detail at some of their methodology. And the evaluations they take years and years to be published, often in an attempt to influence the political debate that's going on. So we've had some Home Office targeted operations. These have all coincided with peaks in the political campaigning period as well. So you can actually see when the government's made major announcements, it's also then publicly released information about these high profile policing operations. Now, immigration enforcement activity goes on every day in every local authority in the country. On average, it is said in London that there is at least 10 immigration raids a month in every London borough. That was a figure given to me about a year ago. I would actually say it's possibly double that at the moment. HOE is the only growth department in the Home Office at the moment. I'll just draw your attention. These are the names of different operations that were targeted. Operation Bartolo was actually targeting Roma and what they were calling dippers, pickpockets in London on British transport. And the idea was that in January 2014, when allegedly we would have this mass influx of Roma and Bulgarians, that they would actually be able to address that issue by showing high visibility immigration enforcement. Nothing happened. The operation lasted a week, and I think they got about 3 people at the end of it. And I don't even know if they were Roma, to be honest. There's a lot of publicity in London about Marble Arch and the encampments that have developed down there, mostly by the Roma community as well. Homeless charities have worked on the basis of payment on results. That means they get paid money for each person they help to get back. And government contracts at the moment in London are written in such a way that you get more money for helping somebody to go back home than you get for helping them to settle, which is a great problem. You have Operation Centurion. Now, if you Google that, you will find a lot of media coverage about that because that was accidentally leaked to the voluntary sector about which places were to be targeted. And there was a lot of work done to that. The most interesting one is Operation Skybreaker. Operation Skybreaker, again, targeted 5 London areas, roughly the same ones where Operation Vulcan was. And it was all about getting people to talk about immigration, getting people to dob or inform on their neighbours if they didn't have status, to highlight businesses, to highlight places where people may be gathering. Now, the problem with Operation Skybreaker is that we said to the government, like we did on the Go Home vans, can you give us a copy of your equality impact assessment? And they told us, now that's a public duty, that we have a right to see that. All government departments have a duty to produce that. The government then told us we would have to request it under a freedom of information process, which we did. And actually, 3 or 4 months later, they asked for extensions and extensions on it. It amounted to nothing. There is a summary of Operation Skybreaker's equality impact assessment, and basically it's 3 pages, which is, I know you can't read that, but it just tells you what the operation is. There's no analysis of what the impact will be on different communities. And the only thing it lists in the full document is a list of Muslim prayer times. So that's the government's understanding about how you enforce immigration and how you assess communities. Operation Nexus is a joint operation between the Home Office and the police. It is originally called Operation Terminus, which tells you a little bit about how they think behind the scenes. And it's got 2 elements. It's targeting high harm national offenders, and it also means anybody who goes into a custody suite, including in theory white British nationals, should have their immigration status checked. Whether that actually happens remains to be seen, and the idea is that anybody who's wanted for an immigration offence will be removed. There are problems with Operation Nexus because it brings into close conflict the territorial policing and the Home Office. And I mean, you can read a more detailed critique of Operation Nexus on our website and other places. But the crossover with territorial policing is possibly what's most dangerous. Now, if you look at the vans, you've got an immigration enforcement van there at the bottom, and you've got a police van. Now, apart from the fact that the words are written there, actually, from a distance, they look fairly similar. Police officers and immigration enforcement officers wear similar uniforms. Now, our argument in London, most definitely, is confidence in policing is at an all-time low amongst Londoners. Now, if you're going to challenge that, you have to understand that policing, and especially engagement with migrant communities, is not just about what we conventionally understand as black and ethnic minority communities. There's more work to be done. There are 2 immigration enforcement officers and a police officer in that top picture. Hardly, the only way you can tell who the police officer is, apart from the insignia, is because he's the one wearing the helmet. There's a term called criminalisation now that's been very popular, and actually that's what we're turning things into. We're turning the whole process of being a migrant into a criminal activity. And people also fall very easily out of status as well. So we see a lot of clients, for example, who are just doing a simple renewal of their 2-year discretionary visa, and they don't have the money to pay for the health surcharge, which has actually got nothing to do with their access to health services. And then they default on that, and then they become illegal. They're back to square one again. And that people fall in and out, and it's nothing to do with having committed a criminal act. It's all about how we as a country have structured our understanding of immigration. Are we storing up problems for the future? Yes, most definitely. As I've touched on some of these already, there's an issue here about if you're a victim of crime, if you're a witness to a crime, and you have got irregular immigration status, are you really going to come forward and report? We've got issues of women who're suffering domestic violence who will not now go and report because they are worried that their partner will be subject to something called Operation Nexus. And it's happened. And it's very difficult for us as activists to retain the confidence of communities we work with when we know policing is the only remedy a lot of people have. So just to end, on solutions, what do we do about this whole territorial policing, everyday policing, and the link with immigration enforcement? We need a proper evaluation of the cost of this. Does it actually work? If we are just engaging in smoke and mirrors, do we actually have to look more seriously at, is this worth it? Is this value for money? Because obviously we're in a recession, etc., etc. Consider rebranding elements of territorial policing and immigration enforcement. Foreign national offenders are one thing, but actually somebody who's been, and I've had a client of mine who stole a chocolate bar from Lidl, who was taken in under Operation Nexus. Asylum seekers who come in through Calais are classified under Operation Nexus, even though it's not a criminal offence to claim asylum. We need to be clearer with victims and witnesses about how people's immigration status will be dealt with. We need stop and search to also look at what's happening locally around immigration. We have the mechanisms there. Why are we so scared to talk about immigration enforcement? And I think that's the point I'd end on, that actually immigration enforcement, it happens all around us. It's overt and it's covert. But actually we have no scrutiny over it. We have no power because sadly, over the last couple of years, we've just come to accept that immigration enforcement is part of the immigration journey. And I'd submit to you that it is not. Thank you.
Thank you very much, Rita, for your wonderful presentation. And we look forward to having some questions later. So I'd now like to welcome Lee Daines, who is Executive Director of Doctors of the World, who are based here in Canary Wharf, but they're working, as I said before, in inner London, in Calais, and in other parts of Europe. So I will hand over to you.
Thank you very much. Good afternoon, everyone. Thank you very much for hosting us. I'm here with my colleague Lucy Jones, who is the head of our UK programme and who also follows our long-term health programming in Europe. I should clarify, we are in Canary Wharf as guests of the Canary Wharf Group and therefore pay no rent, just so that's clear from the off. We are an international humanitarian medical organisation working both at home as well as overseas, largely through very generous volunteers who give us their time and their talent, and we understand ourselves to be an organisation of medical activists. With a particular focus on reaching and working with excluded groups to effect social change. We run both short and long-term health development programs in poor countries. And one particular area of focus, including our work in the UK and elsewhere in Europe, is with destitute migrants, including undocumented migrants who face multiple vulnerabilities. Each year we synthesize and publish data about those patient cohorts across our work in Europe. This latest report, which is available on our website, doctorsoftheworld.org.uk, was launched in May here in London and has a particular focus on the vulnerabilities and therefore the health needs that we see amongst pregnant women and children in Europe. And I just wanted to briefly reprise some of those findings. You see that the majority of the patients that we see are poor. Most live in insecure and often very inappropriate accommodation. A third doing so in conditions which are harmful to their health or that of their children. And they are isolated, lonely, and extremely excluded people. Equally shocking is the experience of our service users of violence. We track a range of data related to that, but one of the most shocking stories I've heard in the 3 years that I've worked with Médecins du Monde is the story of this young man. He's a 14-year-old Afghan boy living alone in Athens in Greece. He came up out of the subway to be confronted by 3 men dressed in black. When they asked him, "Where are you from?" and he said Afghanistan, they set about beating him up. They hit him around the head with an empty beer bottle and left him on the street. And a passerby brought him to the nearest Médecins du Monde clinic where he was given some basic care and then taken directly to the hospital. The hospital treated him and then discharged him back onto the street in the middle of the night because he had no health insurance. And sadly, this is not an uncommon experience. In relation to that data that we collect, it's ostensibly about general health, physical health, and mental health, and the important part to focus on is on the far left here. So our patients report that they have much poorer personal health if they've experienced violence. And we also know from that work across Europe that there continue to be significant and really institutionalized, if I can use that word, barriers to accessing healthcare, often administrative, including here in the UK, but will also often be simply a lack of knowledge about rights and entitlements to care. And our particular raison d'etre is to enable excluded people to realize their right to health by getting the essential healthcare that they need. But these continue to be significant obstacles to attaining that goal. This slide illustrates the situation across Europe and in Turkey for undocumented migrants, and you can see the situation is not great in many places if you are in need of healthcare. We anticipate that our own government will consult again about further proposals to further restrict access to healthcare here in the United Kingdom by extending the existing charging regime that applies in some circumstances, and that is something that you might want to follow and support us in moving forward. More on our website, doctorsoftheworld.org.uk. I say that because I didn't have the helpful last slide, which tells you how to find us, for which I apologize. So in summary, I'm sorry to say for excluded groups, including asylum seekers, refugees, undocumented migrants, sex workers, Roma and Sinti groups with whom we work across Europe, access to healthcare and the effect on personal and community health is not good. Especially worrying for us is the situation of pregnant women who are receiving commonly no antenatal care whatsoever. I want to just read you the very, very short story of one Ugandan woman we saw in our Bethnal Green clinic last year. She was trafficked to the United Kingdom from Uganda after being tortured and sexually assaulted. She managed to escape and sought sanctuary with some people from a local church here. She needed medical help as she was bleeding and was pregnant following rape. We were able to support her to get legal advice and to get assessed as a potential victim of trafficking, although that was an extremely frustrating, long and difficult process. her local GP surgeries refused to register her, as she did not have any formal documents that in fact are not at all required for anyone resident here. So we escalated this case to NHS England, who managed to negotiate her registration with a GP practice in the end, and she was able to access counselling and medication through the GP and receive antenatal care, patently a situation that should never have arisen in the first place. This, though, is true, sadly, across our work in Europe. I apologise for the dreadful screen grab. I'm totally illiterate in such things. But this is from our friends at Oxfam. I'm sure you've seen it. We're meeting today on the second day of the Valletta Migration Conference that European leaders are attending with the African Union, and the flag on top of the wall says EU aid. And we, as humanitarian actors, agree strongly with Oxfam when they say that development assistance should not be used as an instrument of immigration enforcement or immigration policy. And to Rita's point, we see every day in our work the increasing securitization of borders, along with the criminalization of migration and the actions of these extremely pernicious, opportunistic people smugglers, forces extremely vulnerable people to undertake very perilous journeys to and across Europe. And I'll say a little bit more about that in the next slides. But we also strongly agree with Amnesty International when they say that they're flabbergasted in the context of the Valletta Summit, because where there is a political will, there is always a way. And this situation, as we know, there's a shocking absence of any political will to sort out a problem that could be sorted out. This picture shows you a little bit about where our organisation, Doctors of the World, is currently operational. We have mobile teams of clinicians right now in Slovenia and Croatia with their backpacks, trying to understand and assess medical needs in those places as the refugee flows and the migration patterns change, and we're trying to reach underserviced areas in particular. You will know from the figures from the United Nations that something like 220,000 people reached Europe by sea last month. Most crossing are from Syria, and I won't recount the numbers who sadly have died, because that's already changed even in the last 48 hours. It's dreadful and shocking. But the UN do say that something like 745,000 people have arrived on Europe's shores, most on the Greek islands like Lesbos and Samos. And I think you heard something about Lesbos earlier, which it might be interesting to go back to if you would like to. But this is the situation for us on Lesbos, where we have extensive medical programs meeting the health needs of new arrivals there who make it to registration and reception centres. I won't dwell too much other than to say our work is ostensibly primary healthcare in those places, and the provision of some basic psychosocial or emotional first aid type help, just in the interests of time. Moving on, this is Calais, or at least this is what's called, from, as you will know, media reporting, the jungle. Refugee camp in Calais. I spend a lot of time there and also in the wider Pas de Calais region. There are other settlements in northern France, not just this camp where you will have heard there are now about 6,000 people. It's an absolutely diabolical humanitarian situation. I've never, in all the years I've worked in humanitarian assistance, seen anything quite so extraordinary. It has exactly the look and feel of a refugee camp that one would expect to see in a very far-flung part of the world, not in a developed Western country like France. And herein lies the problem with Calais and with other refugee settlements in other parts of Europe. They are not called out for what they are, which is a humanitarian crisis. And so the ordinary machinery of the international humanitarian system is stuck. And I include international non-governmental organizations in that, because there's no formal assessment of people's needs, no assessment of particular vulnerabilities. Women and girls in humanitarian emergencies, we know, need specific services. There's no assessment, no formal assessment of those vulnerabilities in Calais, and no coordination of the relief effort. The whole place is a mess, and our volunteer doctors and nurses and psychologists are treating people for health conditions associated with those terrible living conditions and lack of access to sufficient clean water and nutritious food. But also there are extremely high levels of trauma in Calais, which our psychologists are trying to help with. It's a very challenging context because it's a very transient population. People are traumatized often from the context, because of the context from which they come, the nature of the journey, and seeing loved ones, family members and friends dying en route, having been tortured in places of forced detention in Libya, and then the hopelessness of this situation. Imagine the hopes of your family rest on your shoulders with whom you are in contact daily by mobile phone. You arrive in Calais, it may not look dissimilar to the place you fled, and you see these fences getting higher and higher and higher. It's absolutely extraordinary. And so the sense of hopelessness and frustration is enormous. We had one very small victory. We sued the authorities because they are an enormous hindrance to addressing the situation, and a court has ordered that some more basic things need to happen, like the collection of rubbish, the installation of more water points, and the provision of food. However, having said that, we worked with a team from the University of Birmingham who went and did an environmental study in Calais and found, for example, that the very few water tap stands that have been installed by the authorities are contaminated with human feces, for example. And, you know, there's confirmation, if it were ever needed, that that Calais is indeed a humanitarian crisis. The other thing I find really bewildering about the situation in Calais is you see it, this reference to the Sphere Project. The Sphere Project is an internationally agreed set of standards. It's a handbook for the provision of assistance and protection in humanitarian emergencies. And I can tell you, every aid worker has the Sphere handbook tucked underneath their pillow. We have the principles inscribed in vellum hanging above our bedsteads. There's no handbook of standards for the provision of protection and assistance in Calais. It's a shame on us. And maybe I can go so far as to say, if it were a refugee emergency in any other part of the world, perhaps you might see the calling of a disasters emergency committee appeal, celebrity telethons, advertising on every underground train in London, in every bank and post office in the United Kingdom, and every humanitarian charity would be asking you for your hard-won pounds in order to respond, if they're not already, so they can start something, and the flags would go up. Calais would be covered, but of course it's not really about humanitarian need in Calais, it's about politics. This is Idomeni. Idomeni is on the border between Greece and Macedonia, and our volunteers work through the night, sometimes conducting medical consultations, psychological consultations with head torches, because this is at the moment, one of the principal transit routes through which people pass as they seek to make their way to other parts of Europe. And this is our clinic, one of our clinics in East London, where our volunteers are providing essential medical care and referrals to other service providers, principally for undocumented migrants. The patients we see are not visitors. They live here, and on average, they've lived here for at least 6 years before they seek a doctor's help. One fifth of our patients say They haven't approached a doctor before, to Rita's point, because they think they're going to be arrested. So imagine doctors are not border guards. The duty of a doctor is to treat the patient in front of them. And in fact, by far the majority of our patients, if not all of them, have the right to register with a general practitioner, but invariably are refused. So borders and health. Just very briefly, transiting from one territory to another, in our experience across Europe, has a significant adverse effect on physical and mental health, often either because people get trapped up against those fences, which is what we see in Calais, and live in diabolical living conditions, which trigger not just physical health complaints, but also often mental health problems, but also because they get pushed between those different legal jurisdictions. I showed you the map with the different colours, and so that creates further bureaucratic barriers to access to healthcare also. And as we have touched on already, the securitization of borders, the criminalization of migration, or the rhetoric around that at least, and the actions of opportunistic, pernicious people smugglers is forcing people to take these desperately dangerous, often life-threatening journeys. So, like Rita, we try to see some ways forward. Where a humanitarian medical organization, no amount of humanitarian medical assistance is going to solve Calais. That's in the hands of politicians, and we write repeatedly to Mr. Vaz. His committee has yet to call forward anyone to give oral evidence about the humanitarian situation in Calais, so we'll keep pushing that point, but that has yet to happen. Situations like Calais are understood to be about security and economics, not about humanitarian need. So I think that's the place to stop. Thank you very much.